Ora Fiado, Ewa Humana Serene Juchunko. Gloria Fiado, good afternoon.
Yeah, good afternoon.
I hope you're well.
Yo, I'm let's say some only that have some small malaria over here due to the flooding situation here because there is a lot of mosquito here that are biting us. But we are okay.
If you say you are okay, how okay are you?
Though at first, I mean the stress, how the thing happened in the beginning. As assembly member, you have to going up and down to evacuate the people. Those who they are affected, you have to evacuate them, their belongings, some other things to look for a room for them. Let's say shelter. Some of them you have to give them a room in a church room, relatives and some other places. So it's a big headache for assembly member here.
Within your electoral area, how many people have been rescued?
That's 917 victims. 917 and then 72 household. 917 and 72 household.
917 from 72 households.
Yeah, 72 household. Yeah.
Okay.
They are the people have been affected.
So tell us, these individuals, have all of them left their homes?
Yeah.
And where are they? Yeah. Where are they now as we speak?
One Kenkesela, she is staying at the chapel, Zion Ministry Chapel, and then the rest, they are staying with their relatives and some friends from. Let's say we have a place called Pekpo, Mujakpo, Accra, Newtown, Leve, Dabala. Some are living in the MP's south in Dabala, and also the PC, Honorable Lukuto. Some also, they are there.
How are their conditions like, Honorable?
Actually, their condition is so terrible, so terrible. Because let's say food, clothing, health hazard, those things. They are very drinking water. Those are the things. Yeah, that's the thing they are passing through. Even at my house, from my house to the to the water is about 50 meters away. You could see that the surface of the water is green. The surface of the water is green. All the houses, about 72 houses. They are submerged in the water. If you are here, you can see the houses far away. Comboni Basic School, Comboni Basic School, and then the Quinibeto Basic School, Comboni Technical School, Comboni Hospital, the mortuary, the substation, Greco substation. All those things, they're in the water.
I understand power supply was cut when the waters were released. Have you had power supply restored?
Yeah, we have, let's say from the Greco, the one here, the one in the water, for that one, it cannot operate now. So now we are taking, they are taking power from the substation at Flau. So sometimes, right now we have low currents because that substation, you see, is overloaded. So we are having low current. And then sometimes people will get sugar copy. Some people will get it in daytime, and then some also in the night. So this is why we are dealing with the light situation here.
I would want to understand. You mentioned that people are suffering because they are not getting food to eat. Is it that you people have not been receiving some of the relief items?
Yeah, we received only one relief item from Ghana Gas. That's the only relief item that we received.
What was it that Ghana Gas brought?
Ghana Gas.
What did they bring? What did Ghana Gas bring?
They give us, let's say in my electoral area, I received 128 bag of rice, cooking oil, sandy, maize, gari, tin tomatoes, toilet roll, and then mosquito coil. This is what receive. It's not enough because those who are affected is 917. So 128 items. It's even doesn't reach even a quarter. So people still we need support. Still we need support.
Honorable, I want to find out from you.
Yeah.
Since the incident happened, have you had any member, any executive from the National Disaster Organization, the National Disaster Management Organization, visiting you and giving you any relief items?
Oh no, that's the Ghana Gas Company that they are the only people who give us that relief item. Apart from that, nothing.
When did they bring this, please?
I received them Friday, and then I shared it to them on Saturday.
And the 917 people, all of them were able to have pieces of whatever it is Ghana Gas brought?
No. Let's say only 128. 128, those they are the people who receive the items.
So I would want to find out the remainder. How are they surviving?
Yeah, that's my problem now. I appeal to some NGO that they also come in and then help us. But up to now, we are looking for to receive something, some release items from them. So, as assemblyman, I don't know what to do. I don't know. I'm trying my best, but our chief executive also is trying. He also is trying very hard also to get something for us. Our Queen Mother, Mama, the Queen Mother of Swakope, Mama Monye with the second. Also, she's talking to VRA, especially to so that the VRA can come and then give us some medicine because now, let's say if you enter the water, by 3 days there'll be some rashes on your skin. This is what people are experiencing now. So we are advising them not to get into the water.
But Honorable, let me quickly find out. Why are people entering the water? What are they going to find?
They are this. Do you know we Africans we like fish, so they take their nets for fishing, which is it's not advisable. We told them several times, but they cannot listen. Some people maybe in the night. I have a committee. We have to walk around, and let's say if we see any people in the water, we have to caution you. But in the night, we cannot do that. So sometimes they'll pass by us and then went into the water.
So let's
information center here. We are making announcements every day morning and in the evening, cautioning them not to go into the water. But still, human being.
They are still going.
Yeah.
Let's talk about the water itself.
Yeah.
How is the level like? Is the level reducing as we speak?
Yeah. There's a block. There's an uncompleted building here. From the ground, we have 4 blocks. So the time the water came, it covered everything. But now it's on the second block. Yeah, that's the measurement you have. So now the water is going back gradually, but we don't know what will happen again.
So from the 4th block to the 2nd block, that's the improvement you've seen in
Yeah,
about
that's
2 weeks.
fun to see.
Do you happen to have public health service personnel amongst you treating people? Because you mentioned that when people enter the water, they happen to get rashes on their skin. Do you have public health service personnel around where the people are to take care of them?
No, that's why. And then the Queen Mother of the Suakope will discuss this issue with the VRA. That they should send health workers to us. So that we have a health screening. To give some medicine to the people. If it happens like this, typhoid, malaria, diarrhea, and some all kind of sickness. Skin rashes. So that's why we are appealing to VRA to come to our aid, so that they will give us some medication to solve this our problem, especially diarrhea and then typhoid. That one is very, very, very important. It's very, very important because if you have diarrhea and then the typhoid, to treat it, it will take a time.
So 917 people have been affected in your electoral area.
Yeah.
I would want to know whether all of them are at a safe haven that has been created by you yourself and other community leaders.
Yeah, I may say no. Everybody, is safe. Because some of them, they are living with their relatives. Some are in the church room. So I may say, all of them, they are safe. No any casualty. For that one, we thank God for that. That there's no any casualty at all.
Tell us about sanitation issue. How is sanitation like at those places where you mentioned the people have gone to lodge?
No, that place, the sanitation issue is, it's okay. It's okay. But let's say along the water bank, for that one, the sanitation very, very poor. So that's why we don't want anybody, to enter into the water, because there is a school, the basic school, Comboni Vocation School, the guest dormitory, there's the public latrine over there. Yeah, all these things submerged into the water. Yeah, it's not. It's not good at all. It's not the best.
It's not.
Yeah, you see some of the women part, they are flowing on the water. Plenty things. It's not the best. It's not the best.
Honorable, hold on. Mask.
Yeah. Honorable, good afternoon.
Afternoon.
Okay, so listening to you, it appears that your electoral area is isolated from government relief efforts. Is that true?
Yeah.
Your area is isolated from government relief efforts.
Yeah, government relief. I told your friend that only Ghana Gas Company that give us release. Apart from that, there is nothing.
You belong to the assembly, and which assembly is that?
South Tong District Assembly.
South Tong. And have you seen the district or municipal chief executive in the area?
Yeah. I work with him. He also is trying so that the government also will send us something. He's trying his best, but the things they are not arrived here.
And so you are telling us that where the people are lodging now, government has no hand in that.
No, not at all. Not at all. It's we the assembly, myself, and then some of my colleagues. They help us. Still, people are living the area still.
And how is it?
Because the sanitation hazard is not the best. So some people still they are living.
So you are
Because-
saying that NADMO has not been there, you have not seen military personnel there, and you have not seen officials of Ghana Health Service in your area.
Yeah, no. Only in the DC and then the MP. I mean, they came here. We went around to assess the damage and then some other things. The DC said Honorable said Kwesi Agbi, and then the MP Honorable Minister Koblan Oyumi. I mean, they were here together with some of the NDC executives. They are here.
Okay, so you gave two places where most of the people are lodging. You mentioned the House of the Member of Parliament, and you also talked about a PC. That means, I suppose that is a parliamentary candidate, right?
Yeah.
Okay, so how many people are there in the House of the Member of Parliament?
For that one, I cannot give you the figure, but those Comboni nurses, Comboni, the hospital workers, and some of the teachers, they are there. Some are in the PC's house, and then some are in the MP's house.
So you may not have the majority of the 917 people displaced in the houses of these two people.
Yeah. I cannot give you the exact figure. If I say something, I will lie to you.
Can you say the number that you have in the school, in the public school?
In the public school, come again.
Can you tell us the number, or give us?
The public, we have Comboni Technical School. They are more than 1,000, and then Comboni Basic School, and then Comboni, and then Quimbeto Basic School. They are getting to, over getting to 2,000. It's a two stream.
And all these people have not been attended to so far as government relief efforts are concerned.
Oh no. For that one, there's nothing for the schools. For the schools, nothing.
And you mentioned some people are also lodging in churches.
Yeah.
And how many
A Kenkesela.
A Kenkesela's house or a church?
No, a Kenkesela is in the chapel or the church.
So how many people are there in the church?
They are about 15.
Okay. So where are the rest of the 917? Because you are telling me quite a handful are in the house of the PC and that of the Member of Parliament, and 15 people in the house of the Kenkesela. Where are the rest of the people?
Yeah, some are they are in Bekpo, a village. Closer to Cisneros. And then some people to Klopo, Reve, Bekpo, District Hospital, Medical City, and then Accra Town. So even people are in Dabala, Agokpo, Newtown.
Okay, so it means that maybe these people, majority of them, flee to these communities and may have had government support in those communities.
No government support at all.
I mean, when they went to those communities, you mean that those communities also have been isolated from government relief efforts?
Yeah.
Can you say that for sure?
Yeah, for sure.
Anyway,
for sure. So I want to pass through your medium to appeal to NGOs, philanthropists, anybody at all, that they should help us. So, of literary area, they should come to our aid. We need water, food item, clothes, medication, and then anything at all that people can help us. To have it. I'll be very, very grateful, because we need them. It's something urgent. From they opened the dam. That's on the 15th of October, and then today is 23rd. About getting to 2 weeks now. So we are appealing to you through your medium, so that to give us support or some release item, I'll be very, very grateful.
Something is bothering me.
Okay.
When Musk asked you the total number of people who have been impacted by the spillage, you were mentioning that there were two streams of people, one amounting close to 2,000, the other close to about 1,000. You had also initially mentioned of some 917. Can you tell me whether all of these people are within
no.
your electoral area?
They are the students. Those who are attending Comboni Vocational School, Comboni Basic School, and then the Comboni, and then Kunibeto Basic School. And then since then, I mean, they have not been going to school. So arrangements have been made for them. Today they have started school. Comboni Basic School, they joined their friends at Agokpo RC School. And then Kunibeto Basic School, they joined their friends at Ghana Presby School. So they all started school today, but the vocation technical for them, still they are in the house.
Let me understand something. Are they just schooling there, or they are also sleeping there as well?
Yeah, let's say Comboni Vocation School, we have two hostels, one for the boys and then one for the girls. All those, I mean, they are sleeping there. So after the disaster, they all left. And then some of them, they are staying with their relatives in the town. But for basic schools, the two basic schools, I mean, they are living with, I mean, their parents and then some their relatives. Because some, they are not from Swakope, people from Akachi, Adidome, Plau, Dabala. Yeah. Some of them, they left to join their family. But those who are in Swakope, they are with their parents. Those number, they are not in that 917. No, this number, they are not.
So those numbers are different. But who made the arrangements for the children to return to school?
It's the director of education, the headmaster of the 4 schools, the Comboni Basic, and the Kunimeto Basic, Ghana Presbyterian Basic, and then Roman Catholic Church, basic schools. Those 4 schools with their heads, the assembly members, opinion leaders, they come together and then solve, I mean, discuss this issue, and then they all come to agreement that, I mean, the children should run shifts. So let's say GP school, they will go in the morning, and then the Kunibeto, they will go in the afternoon. And then at Agopo Arushi, they will go in the morning, and then Kunibeto, they will go in the afternoon. Whilst I'm speaking now, the 2 basic school, Comboni and then Kunibeto, I mean, they are in school right now.
Honorable, let me thank you this afternoon for your time.